In this video, we'll discuss about tenosynovitis. Tenosynovitis. What is tendon? A tendon is a fibrous connective tissue. Okay, it is a fibrous connective tissue which attaches muscle of that bone. Okay, so it will attaches muscle of the bone. This one is the tendon, this one is the muscle, here only bone attached. So tendon is a fibrous connective tissue which attaches muscle of bone. Next, one more we are using tenosynovitis. What is tenosynovitis? Inflammation of the thin synovial lining. That lining. Okay, inflammation of the thin synovial lining of a tendon sheet. So in this area affected, inflammation of thin synovial lining of a tendon sheet. It causes from mechanical irritation from bacterial infection. Mechanical irritation causing that tenosynovitis. Two type of irritation. One is because of two reason: irritative tenosynovitis and infective tenosynovitis. First one is what is irritative tenosynovitis means seen in tendon of the hand pain and swelling. So this one will causes hand pain and swelling. Treatment rest analogies, ultrasonic therapy, local hydrocortisone infiltration. So irritative tenosynovitis seen in tendon of that hand. Second one is infective tenosynovitis, infection of the synovial lining of the tendon by pyogenic and tuberculosis bacterial infection. Pyogenic infection common in flexure tendon of the hand. So infective tenosynovitis because of pyogenic and tubercular bacterial infection. Tubercular tenosynovitis of the sheath of the flexure tendon of the forearm at the level of nearest occur commonly compound plummet ganglion. Next, tendinitis means the damage of the tendon. Damage of tendon is a connection of muscle to the bone. So when you have connection of the muscle to the bone damage, so that bone damage in this area, mainly the wrist area mainly affected. For example, in the case we call in this case only we are calling tendonitis. Here what this one will happen: overuse of the muscle. It can happen, right? Okay, the attachment of the bone, it can happen a little bit further between the muscle and final attachment of the bone. Sometimes you do not have tenotitis, have tenosynovitis. Sometimes we have tenosynovitis, means the tendon has inflammation, has damaged, but more importantly, the damage is happening in the cover or sheath of the tendon. Usually, they are together. Have short of swelling and pain, short of swelling and pain on the tendon also. You have on the cover of the tendon, the cover of the tendon is called a synovial. So tenosynovitis, it is the inflammation of the tendon and the cover of the tendon which happen in some areas more commonly, such as wrist and the disease is called as thicker vein disease, which is the pain of the movement of the thumb due to overuse of thumb activities.